Good evening and welcome to For the Record. October is dedicated to raising awareness on breast cancer. It's been nicknamed Pinktober. And tonight on the show, we'll be doing just that, talking about breast cancer and what it means for women who are diagnosed. Our guests tonight are Dr. Ronald Kumar, a surgical registrar at the CWM Hospital, and Asena Senimuli. Asena is a cancer survivor. She'll be sharing her story with us tonight. To both of you, welcome on the show and thank you very much for being here. I'd like to start off with you, Doc, just about the prevalence of breast cancer in Fiji. I understand there have been some studies done. There are some numbers about how many women in Fiji are diagnosed. What situation are we facing right now?
Thank you, Edwin, for having me on the show. Worldwide, even the breast cancer rates at about 1 in 8. 1 in 8 women can get a breast cancer over her lifetime. So the breast cancer risks, as the woman gets older, the risks get lesser over time. Now, we've had a few studies done in Fiji, and first of all, we were not able to keep good figures over the past few years. Now, in the last 5 years, we've got some numbers, and we've got some numbers of the number of surgeries we have been able to do in Fiji as well. We've had figures from 2013, and in total of about 181 cases of breast cancer was detected in Fiji in 2013. That is all the numbers that are presenting to hospital. That does not include those people who do not turn up for workups and for surgeries. Now, how are we comparing with the world? We are getting lesser number of patients, basically because of patient presentation. We do not get everyone presenting to hospital with breast cancer, and but that does not mean that our breast cancers are any less compared to the rest of the world.
So we're pretty much on par with the trends globally, but there is a reluctance by women to show up and be tested, isn't there?
Yes, there has been a huge reluctance, and what we are faced with is late presentations. The reasons some patients would present is they've had a big wound, big ulcer. They are brought into hospital not because they want to, it's because one of the relatives is tired of looking after the patient with a bad smelling wound. So they turn up few years down the line after being having a lump, and we see them quite late.
Asena, you're a pretty similar case. Until about 4 years ago, you had breast cancer, and you went through something similar. You were in denial, I understand.
Yeah, in my case, I made my way to the hospital not because of breast cancer. It was because I wanted to examine my life. We were about to leave the Fiji Police Force for further studies, and I was thinking of the health insurance money for my husband, and borrowed that money to, be allocated on me. So it was done, and I was checking my life in a medical center in Sese, and then everything was good. I said, I don't think so. Everything is good. Then the doctor said, why? Because all the tests that we've done on you, scanning, x-rays, blood tests, they all say that your life is good and normal. And then I said, okay, I've been having one, like it was hard on top of my breast. I did not know whether that was what the doctors and nurses were saying, the lump for breast cancer. I asked the doctor to just check on me. Can you just check on this lump? He said, okay, then now we'll have to start again. And then when I went for scan, they said there is a lump of about 1.5 centimeter. I need to go as quickly as I could for removal and for testing for breast cancer. Then I said no. I need, to confirm it further on. I did not believe in what they said, and I said that they should go for further tests. Don't do anything on my life yet until you confirm it with me with a good result. Then they sent me for mammogram. The mammogram said yes. The result was 1.5, and then they arranged for surgical. It was too quick for me to take all those things in 1 week's time. I said, no, you have to do something else. Okay, then we'll send you for biopsy test.
And I mean, what you're describing to me is a sort of a phase where you're in denial, and then there's fear that comes in.
Exactly. I was in denial. That was the process of denial. I really did not want to believe it. And then I was demanding for more. When I even had my biopsy test and they gave me the result and they said it was suspicious, I even said I didn't like the word suspicious. I want to hear positive. To say suspicious to me is not a very good word for that time, because I wasn't feeling sick. There was no pain in me. It was just one hard thing on top of my breath that was okay with me. I felt that it was not a problem at all. So I said, give me back my result. I'm going back to the medical center. I took my result back. The same explanation that I got, information I got from CWM hospital was repeated in that room. And then I said, I need another, a greater person in the breast cancer department to talk with me.
Okay, we'll pause for a second here, Asena. We'll take a break. We'll be right back.
And if you have advised the surgery, if they are happy with it, we would go ahead and book surgery. Otherwise, we always call these patients back at a later date, a week or two. We'd call the patients with their relatives and talk about it. Because patients would always want to go back and see what the relatives have to say. I think it's culturally one of those things that in Fiji that the patient falls back to is their relatives. And sometimes the patient would agree and go back to home, and they've had a discussion and come back and tell you, doctor, I'm sorry, I don't want to have the operation. Now, in those situations, patient wishes need to be acknowledged as well. So we'd call for repeated sessions of counseling. Our oncology services would get involved. We would get counselors involved, and we would get another colleague of ours. We get someone else to give a slightly different approach to what he did about diagnosis. But sometimes patients just blatantly refuse not to come. Some would. The other big issue we have is fighting for patients to bring in who go in for traditional healing. I mean, we see patients who've gone through the whole phase of traditional healing, don't get better, get worse actually, in fact, and turn up to us few years down the line and ask for an operation. Now, that is one of the things that becomes more difficult when a patient turns up a year down the lane, rather than having it's much easier operating on a lump which is a centimeter or two, rather than operating on a 10 or 15 centimeter lump. So that's a huge process that we need to overcome. Is traditional healing is one of those. How we have from the hospital side, from being doctors, how we have approached patients into counseling them and bringing them back into the clinic. Our oncology services are getting more active, and they do follow up a lot of our patients who have defaulted.
Asena, you opted for traditional healing as well at one phase, didn't you?
Yes.
Why did you feel the need to do that?
Just as the doctor said, influence from outside me. I had relatives from Vanua level. Actually, I'm from Lambasa, and I have my relatives on the other side, whom they've been seeing patients going into traditional healing. And some of them advised me, don't go for operation, come. You can go to this lady for massage and yes, herbal medicine. I had to ask the doctor to sign me out to just go through it, because my relatives outside there were with me for the traditional healing. Another thing was my faith. It was my spiritual understanding about my life. I was thinking, how about I ask the doctor, how about my faith? Can God save my life? He said, yes, but you have to have big faith. Big faith to God is our creator, and we as doctors believe that we stand here for God's sake to save people. And so I'm signing you out only if you promise me that you come back after 2 weeks, just to check up on the traditional healing. If it doesn't go well, then you decide again whether to come back for operation.
So what happened after 2 weeks?
After 2 weeks, I came straight back and demanded for the big biopsy test, which was done by the surgeon. Yeah.
So traditional healing didn't work?
It did not work. With me, it did not work. Maybe with others it worked, but with me, it did not work.
Were you searching for answers because you felt vulnerable after you were diagnosed?
Yes. I was studying, and then I was thinking of losing everything, losing my studies, and even though they were saying that your life is more important than your studies, you have a good life, then you complete your study. And I was even more vulnerable. I wanted to get well, and I wanted to be healed, but I was going in other directions rather than going to the hospital.
I'd like to pose a question to both of you about what a woman goes through as the breast cancer progresses, if she doesn't seek treatment, or if there's a late diagnosis. What are the physical reactions that happen, and what sort of pain did you go through, Asena?
In my case, I was not feeling any pain with regards to the lump, but I was feeling very weak at times. I was losing my strength. Like I would do my housework, and all of a sudden I'm out of strength. So I just have to lie down, be in bed for about 1 hour, 2 hours, and then I get my strength back.
What are some of the physical manifestations of breast cancer?
I guess taking back to why patients don't present is because they have a lump, and most of them would not have any symptoms in the first few months or years. I mean, if it's not a very rapidly progressing lump. So most patients will have a lump which might not cause any pain to, and that's hence the reason most patients don't present. So in later stages, once it starts to grow bigger, the other things that can cause is pain once it's big enough. Once it's formed an ulcer, it will start bleeding. Patients lose a lot of weight. Once it spreads elsewhere, bony pains. The bone pains are really, really bad, and they need to be on a lot of pain medications, very high doses of morphine and codeine medications just to control those pains. So this is late stages. But as I said, initial phases, most patients will not feel anything apart from that lump.
Okay, and that's the end of another segment. We'll be right back after this break. Good evening and thank you for joining us. Our topic tonight is breast cancer. Our guests, Dr. Ronald Kumar, a surgeon at the CWM Hospital, and Asena Senimoli, a cancer survivor. Asena, you've been taking us through your experiences, a very difficult story, very painful story, but it came to a stage, I understand, that you had basically given up while we were talking off camera. How was that for you?
Like I said, I promised the doctor to say, if he signed me out, after 2 weeks I'll come back again. So I had to stick to that promise. I went straight back to the hospital. After I received my result, as I was positive with cancer in stage 2, and I was it was very aggressive. At that stage I was not in pain, but I made my choice. I was even braver and stronger. And I had conflicts at home. They even advised me not to come into hospital. Enough, you've done your traditional and all these things. I said, this is my life. This is my pain. This is about my choice. So I'm going back to the hospital.
And what happened then?
And then I gave my result I went back to CWM hospital, because what Dr. Siti advised me to do was, when you come back, don't come back to the medical center, come back to CWM hospital, because in there you don't pay anything. If you go for your operation, it's just us who are coming to meet you here. We are doing the operation out there. So that's your hospital. You are free to come in any time, and we'll serve you freely. And that was it built confidence in me. And I went right back, gave myself in, was ready for operation.
You had to have 2 procedures, from what you told me. The cancer came back.
Yes. After my first operation, when I was called back for my review, I was told that I needed another immediate operation, because the result says it was on the margin, and they need to operate on me one more time. They sent me home and asked me to wait there for their call. It took 1 year, and that 1 year, in those days, every day of my life, I was in pain. That was the time I experienced pain. Pain that I cannot explain. It was, I could not bear the pain. I wouldn't want anybody to sit beside me to comfort me. I wanted to carry the pain alone. So pain was day and night. And imagine, for 1 year. And I was preparing to die. The only thing that I wanted was just to die, to rest in peace. And I was praying every day that I must rest. I felt that my body could not take the pain anymore. It was too heavy. Cancer, in my experience, is very hot. It's bubbling hot. That hot when you see the kettle boiling. That happened to me.
You're meaning about what you felt?
Yes.
Physically? Inside.
Yeah, physically, with the pain, together with the pain. So I was hot inside. I was burning. And I needed fan on me day and night, non-stop. And I was drinking ice water to cool me down. And yes, I was desperate. I was trying to, tell my relatives and my husband and my children that please release me. Don't pray for healing on me. Just pray that I have peace and I'm gone.
You just wanted it all to...
Yeah, I wanted to go, just to...
Okay. Well, I mean, you're here with with us today. You're healthy. You're strong. We're glad to have you. But I mean, that Asina's experience, is it common for women who are diagnosed with breast cancer?
Yes, very much. I mean, apart from the fact with the pains, with advanced cancers, as I was saying earlier, once these cancers spread, remember, cancer cells work more faster than everything else in the body. So it does take a lot of toll on the body. I mean, whatever a normal patient takes on a normal diet is not enough. So they tend to lose a lot of weight. They are in a lot of pain. Once it gets advanced, it breaks through the skin. Once it spreads to the bones, it starts to break through the bone. We've had patients who have actually been paralyzed because of the cancer spreading to the backbones. So, and it's not a pleasurable way to live with a big lump on the breast and not being able to walk, being soiled in your diaper, and not able to pass urine on your own, being soiled in your diaper with your stool. It's not a pleasant experience when you see patients coming late to hospitals. And so the way it happens is that at every week or so, we'll have 1 or 2 patients who are in hospital who haven't presented early or who have relapsed after treatment. They would be suffering for a long time in hospital before they pass away. But it's a painful experience.
What about the mental effects on a woman, being diagnosed and then having treatment? If it comes to a stage where they have a mastectomy, all of these combined would obviously have some sort of mental effect as well.
Yeah, even with the studies that have been done on what effect it takes on patients who've been diagnosed with breast cancer, those who've had mastectomies, it's how they look at themselves. It's one of the things they don't talk about. It's the sexuality that women are quite worried about as well once they have had a mastectomy done. And mentally, it's a huge challenge on the patient, thinking, when will I be cancer free, or if this is going to come back. And these are one of those realities that these women are faced with that most of us won't be able to think about. I mean, the common man to think about things like this is not one of the things we'd be able to think very well about. But the amount of mental stress these patients have is a lot.
I mean, when a woman does have a mastectomy, not you personally, Asena, but in general, do you see a case where the husband may not be supportive because they don't want the physical appearance of their wife to change?
We've had situations where that has happened, when the husband says, when the patient is like, great, look, I want to get rid of this cancer, and the husband says, no, you should be fine. And this is where we need family support. We need everyone else in the family to support on a planned operations of the sets. Elsewhere overseas, there's a lot of work into breast conservation therapy, but those are done with small lumps, non-palpable lumps. Here in Fiji, we get huge lumps, 4-5 centimeter lumps, and most of these lumps we cannot do a breast conservative therapy. We can still offer breast conservative therapy if patients present early. Lumps are quite small. You can take out these lumps and then send them overseas for radiotherapy. So it's one of those things that is coming up, and that's one of the things we can really look at if we have early presentations. But importantly, everyone needs to present early.
Okay, and that's the end of another segment. Stay with us, we'll be right back. Pulavnaka, welcome back to the show. We're talking about breast cancer. Asena, I'll come back to you. From your personal experience, what you went through, say a woman is sitting at home right now and she has some suspicion that she has breast cancer, but she's not ready to do something about it. What would you tell her if we were to end this show tonight and feel confident that we've made a change in at least one person's life? What would you say?
I would say that the best place to go to is to go for breast clinic. And I would also share with the women out there, that's what I'm sharing from my past experience when I survived. The most kindest people that I found in the world are in oncology and the doctors of breast cancer. Yeah, they know how to treat us. They know how to talk to us. They know how to respect us. They are trained to do that, and they are smarter than us, more smarter than us. Don't be afraid. Just don't be afraid. Come and give yourself in for checkup. If you are afraid to go to the clinic, then go to oncology. Speak to the nurses first so that they arrange for somebody there.
Does it take a lot of strength? Did you have to be very brave to actually decide to do something? Because your situation was that you sort of found out without even ever suspecting.
Yes. It takes a right choice. You have to do the right choice. We have advices all over, everywhere, but get the right advice. I think the right advice now is my advice from me. Take the advice from me, go to the hospital and give yourself in for treatment. If you are worried about something that is happening that's abnormal there on top of your breast somewhere, just go to the hospital and make sure you are all right.
Doc, in terms of services available around the country, people at home may not know where to go or how they can source help. If you could give a general description of where these clinics are available. Are we talking about any health center anywhere in the country or major hospitals?
No. The way the breast clinics work is you don't necessarily have to be a doctor to be detecting a lump for your patients. So the way these breast cancers are diagnosed are triple. So one is we take a good history, talking to your patient, what the risks they have, and then having a look at the breast, examining it, doing a mammogram or ultrasound scan, and then getting some biopsies. So what if someone has a lump? It doesn't equate to breast cancer right away, but it needs a lot of workup before you are able to diagnose someone with breast cancer. So what tends to happen is a patient, anyone can present to any health personnel. So you can present to a nurse and get them to have a feel. If they're concerned, they always refer to a secondary center. The main breast clinics are held at the main hospitals, Lama Salodok and Suva, but other doctors around the country can detect breast cancer as well for you. So if there's a suspicion, they refer it forward to one of the major hospitals, and that's where we do our mammograms, and that's where we can do our biopsies as well.
Are you, well, not you, but is the health service looking at expanding and actually maybe reaching out into the communities rather than waiting for women to show up at the major hospitals? Bearing in mind the geography of Fiji and there are so many people living in remote rural areas.
Yeah, so those outreaches, the public health areas, the smaller health centers, they do a lot of outreach from their part. So apart from screening from other non-communicable diseases, cancers, breast cancers is one of those other things that are encouraged to do. Because women may not feel comfortable around everyone else. The places we're aiming at is the smaller health centers, nurses in the village. They are very close to the community, and they are the very good focal points for patients, the women to turn up to. And henceforth, they can be forwarded to the next center once there's a suspicion. Yeah, there's a lot of room for expansion though. Breast cancer screening is one of those things that can be brought up. As I was discussing earlier, mammograms are being done at the major hospitals, but to get a screening program, to invite everyone to a screening program, it's going to be quite expensive. But the important thing is we can still treat those lumps that patients present with.
Late presentation or women showing up to hospitals too late or at a very advanced stage of the cancer, that's been the problem for a number of years. There are more women showing up now as compared to previous years, but they come at a time when it's almost too late to do anything. I mean, how do you go about getting them to actually take this seriously? Are we talking about more awareness?
Yes, definitely, and that's what Pinktober is about. And while we were discussing at the Fiji National University the breast cancer symposium is why do this in October only. We should be doing this throughout the year. And that's what we plan to do, is advocate for breast cancer throughout the year rather than just in October. And so that's why we're getting all the media to be very proactive about breast cancer. And we need to do more outreaches from our part to get out, to reach out to women to present early to us.
Okay, and with that, we have come to the end of another segment. We'll be right back. Good evening. We're just about to wrap up for the evening, but we still have Dr. Ronald Kumar and Asena with us. We will, for the next few minutes, continue discussions on breast cancer. Asena, you've had surgeries. Do you today feel any less of a woman because of the mastectomy?
I feel good. I've changed my mindset completely and talk to myself and say, you are still beautiful. My family, they are very happy. My husband is very happy, very supportive. I'm continuing with my studies. I'm hoping to graduate this year for my Bachelor of Divinity. Yes, I do my housework normally, and yeah, I don't feel outplaced when I had this operation.
For any woman out there who may have this fear that they don't want to have their breast removed, I mean, you're a classic example of how a healthy, robust woman can carry on with her life, isn't it? Even if they have had their breast removed.
Yes, they should look positively into this treatment. Yes.
Doc, self-examination is something that the Ministry and Health Services focuses on quite a bit, detecting lumps early on. Could you, give us a quick demo on how a breast examination is done?
Now, with the way we would advise a breast examination to be done is for the lady to be comfortable. And if she's not comfortable just being in a room, shower is the best place to examine. The ways that can be examined is firstly, with the hands on the side, have a look at yourself in the mirror. See if the breasts look normal. If they look the same on both sides. If there's an area which is puckered around a bit, if there's an area which looks a bit swollen, those are things that they can just have a look at. And examination with the hands on the side firstly. Feel, as long as it doesn't matter how you go about feeling the breast, as long as the whole breast is covered. The other ways is getting the hands up in the air and examining under the armpit. So as long as the whole breast is covered, that should be a complete breast examination. But I must say that just the breast self-examination nowadays, with the availability of other tests, is not a complete examination. So if you're worried at all, come and see a doctor. Let the doctor examine you, and then carry on further tests like having a scan or having a mammogram for you. But breast examinations are where everyone can start with.
Last question. What is the difference between early detection and late detection?
So early detection would be typically on a mammogram, getting to picking up ladies with breast cancer on a mammogram, rather than having to feel a lump. Once you start to feel a lump, that lump is at least a centimeter or centimeter and a half before you start to feel it. So where we would like to get these lumps is at the mammogram stage, where a woman is a bit worried that someone in the family has had a cancer. She might be a bit worried, get her in, get a mammogram, and move from there on. Rather than getting a lump which is 1.5 centimeters, 2 centimeters, or what we see here is 10, 15 centimeter lumps, which are masses by then, and those are quite late stages.
And what difference does it make having early detection and late detection?
So with early detections, the cure rates are much, much higher. So they are stage 1 or 2 disease rather than having a stage 4 disease. So by the time you detect a lump at small, when they're small, you can do a few things differently. You can do breast conserving therapy. So you do smaller surgeries. You don't necessarily have to take the whole breast out. And then that has to be followed by radiotherapy, of course. But if it's at late stage, remember the operation is always harder with bigger lumps, and that means that the breast has to go the chances that those lumps have spread elsewhere are much, much higher.
Okay, and with that, Doc, that's the end of our show tonight. Asiana, I'd like to thank you, and Doc, you as well. Thank you very much for being on the show tonight. And here's hoping that we've made a difference in somebody's life tonight. That is it for the show for this evening, but if you have any comments or questions, you can email us for the record at fpc.com.fj. Up next is Nemani Ndela Mbatiki with his weekly segment. From me, for now, good evening. I'll see you next Sunday.
Good evening. I'm Nemani Ndela Mbatiki of the Fiji Sun. Welcome to Fiji's only TV editorial show. In my say this week, I wish to alert us to one of the biggest threats facing us as a community and as a nation. We should be aware that the family as an institution is under serious threat. There is an abundance of evidence that this is happening because of the rapid rise in family-related crimes and tragedies. When a family breaks up, it's a tragedy. When a family member gets on the wrong side of the law, it's a tragedy. When a family feud ends in homicide, it's a tragedy. When children in a family stop going to school, it's a matter of grave concern. When homeless family members end up on the streets, it's a national shame. If the institution of the family is strong and intact, none of this would happen, or there would be fewer cases. Early this year, a homeless man was buried by strangers because no relatives came forward to give him a dignified send-off and a decent burial. Not long after that, another man who appeared to have been disowned by his own family was buried with his close friends beside him. At least he had people who knew him and loved him and gave him a proper farewell. The increasing incidence of rape, incest, and other sexual offenses within families and outside suggest we're in the throes of a social upheaval. Predators who are driven by lust and instant self-gratification commit this heinous crime. They use their position of authority and influence to take advantage of the vulnerability and innocence of the victims. It is really sad when the perpetrators are those entrusted to protect the victims. How can we solve this problem? The government alone cannot solve it. Minister for Women, Children and Poverty Alleviation, Rosie Akbar, or Shamima Ali of the Women's Crisis Center, are doing the best they can to create awareness among the communities about the dangers of abusive and violent behavior in the family. It takes a combined effort of all stakeholders, families, community leaders, faith groups, schools, non-governmental organizations, police and other relevant government agencies to address this challenge. While some work is being done in coordinating activities, more resources are needed to be thrown in to make this a regular and ongoing program. Education is the key, both secular and religious. I'm not talking about formal education only. I'm also thinking of training workshops and seminars attended by young people and the elder folks too. Adult education is vital in many of our communities. The importance of the role of the family and parents should be stressed. An increasing number of our people have lost their way. It is underscored by the social ills that plague our communities: the illicit drugs, alcohol abuse, sexual-related problems, and a host of immoral and dishonest activities. How do we prepare young school dropouts for family life? Recently, I visited a home in a village. The parents between the age of 30 and 40 have 5 young children. Both are school dropouts. Both are unemployed. They rely on subsistence farming and the generosity of others. They have no plans or goals for the children or the family. Education doesn't seem to be a priority. They live from day to day, and there seems to be no motivation to do other things to help the family. Generally, they lack the knowledge and skills. Unless there is a dramatic change, those 5 children will end up like their parents. Parents are usually the role models for children. And this is where the proposed adult education can play a crucial role in empowering our people, like this couple, to be engaged in activities that will benefit the family. Goal setting, acquiring knowledge and skills to increase income for the family, time management, budgeting, and other life skills, role of parents in raising children, instilling the principle of work in the family are just some of the topics that should be covered. The government is spending millions of dollars in infrastructure developments to stimulate economic development. We must prepare our people to take advantage of these developments. I am Nemani Delembetiki, and that was my say for this week. For more of my views, you can read the Fiji Sun. See you next week.